This is Chapter 3 under Relationship Quality, Demonstrating Empathy. One definition of empathy is that it's the verbal and nonverbal expressions of concern and compassion for the patient. But also, you can take it a step further. It's the attempt to really understand both the medical condition of the patient and his or her life situation. This is really crucially important when working on a treatment plan. It's not enough, for example, to say to a patient, that must be difficult, without really trying to understand exactly how difficult their condition is or their situation is. You want to get them to spell out in some detail what they're going through so that you can intervene and help them to maintain their health and treatment. So as much as possible, try to find out about activities of daily living, those things that would undermine your good treatment plan. Find out what's going on in their life and work. And also consider nonverbal empathic responses. Not everyone is verbal and have the words to express empathy. Sometimes a little is enough. But also empathy is conveyed through your expressions. It's also conveyed through your touch when doing a physical examination, how you carry out, for example, OMT. So there are lots of ways to compensate for not having verbal expressions of empathy, and these are things that all patients pick up on pretty quickly. One thing to avoid, although you'll get better at it as you get more experience, is the robotic approach to taking a history or doing an examination, where it appears as if you're working down a list of things to ask the patient but are not really engaged with the patient. So as much as possible, try to maintain your eye contact, your interest in the patient, and above all, try to avoid being angry, irritated, or bored with the patient, and to again try to understand things from their perspective. There will be times when you are not up to the task of working with patients because you're fatigued, you've got exams to contend with, you're having personal problems. But it's extremely important that you put that aside and work for the patient at all times.